because we were dieting. Were we watching our weight or watching our height? There was a lot of love in the air yesterday night. Am I telling lies? In fact, when I saw my elder walking with his wife, I looked at him, I said, Oga, this thing no be small thing, no. My friend said it was love wanting thing.
Yes, wanting.
I can still see signs of love flying in the air. I don't want to make anybody jealous. I just want all of us to plan towards it next year. Anything that is about love is a good thing. It's something that we should all aspire to be part of it. And because of that, I know there will be a time to thank all the people that organized it. But didn't our youth do excellently well yesterday? Shouldn't we give them a round of applause? When they do something bad, we criticize them. Yesterday they did excellently well and we are proud of them. It's something we look forward to having every year now, isn't it? Thank our youth so much. Last year, I gave an introduction to Health Talks, and I said that was the beginning. That was an introduction. I want to start from that this year. I want us to recollect what we talked about last year. Last year, we talked about a variety of things. We talked about arthritis. We talked about muscular pains. But we zeroed down on diabetes. Isn't that? And we talked about the effects of diabetes. And we talked about the importance of diet and exercise. Today, we are going to move on to something bigger. Something that is very, very common. In fact, a lot more common than diabetes. I guess you are thinking, what could that be? It's something that happens at the end of many sicknesses. It's something that many sicknesses can lead to. That's why it is one of the most common sickness. In fact, the Pharisees, they approached Jesus one day. They said, of all the laws, which one is the greatest? And he says, love. So of all the sickness, which one is the greatest? This sickness occurs at the end of very many sickness. Can anybody guess? Sickness, disease. Well, yes, hatred leads to that sickness. Heart disease, high blood pressure. High blood pressure. We are going to talk about high blood pressure. Let's go to the next slide. As usual, I like to start my health talk in church based on a foundation, and I always want my foundation to be in the Bible. Last year, my foundation was, my peoples perish for lack of knowledge. Today, my foundation is from the third letter of John. If we read the second verse, it says, Beloved, I pray that you may prosper in all things and be in health. That is the foundation. That means you may prosper in all things and not be in health. And that is not what God desires for you. It is only when you prosper in all things and yet you are still in health, that is when you satisfy God. That meets the satisfaction of God. The next slide, please. Next slide. When we talk about hypertension, it has to do with heart. It has to do with heart. Now look at the three pictures. What do they have in common? They are all pumps. And I'm not an engineer, and I know some of our children are very good in engineering. They tell you the mechanisms of pump. They tell you how the pressures are transmitted. Now, when we talk about blood pressure, have you ever thought about this name? Why is it called blood pressure? Why do you think it's called blood pressure, not any other name? Why? Because it has force. It has to do with force and resistance. It has to do with force and resistance. If you look at the smallest pump, the bicycle pump, in those days you buy a bicycle, the pipe has one pump attached to it, you bring it out. Very simple pump. You pull it out, you pull the plunger out, and then you push it in. As you are doing it at the beginning, it's very easy. When the wheel is being filled up, at the last one, you push and it's not going anymore. You say it's enough, then you disconnect it. That is how the heart works. At one point, it's relaxed. At another point, it pushes in. So there are two aspects of the heart, a relaxed heart and a pumping heart. That is why we have two numbers when we say blood pressure. Have you noticed that? There's one number on top and there was one number on the bottom. When I was in medical school, I used to say, why didn't they focus on one number? So we have only one number to focus on. Why don't they put one in front and one at the back? Why must one be on top and the other one at the bottom? If you are using a computer, putting one on top and the bottom is usually very difficult. The way it's normally written, you put a slash. So I used to complain all those things, but it is important why it's done like that. Next slide, please. What is we normally write? Normally, when you come to hospital, for every adult, we would like to have a blood pressure of 120/80. 120/80. I'll explain what 120 stands for. 120 is when you are pumping to the maximum. That is not when it is relaxed. Imagine a plunger. When you push the plunger to the end, that is 120. When you pull it out to the beginning, that is 80. Which means your heart, even at a relaxed state, it has a pressure of 80 millimeters of mercury. That is a relaxed heart. Now, a hard-working heart has a 120 millimeters of mercury. So when it goes up, I'll talk about why it goes up. The next slide, please. Now, how do we generate blood pressure? It's by heartbeat. As we all are, our hearts are beating. How many times does the heart beat in a minute? 82. About 80. Can beat faster. If you just walk up the stairs, your heart beats faster. If you run, it beats faster. If you have some kind of sickness, if you are an athlete, because your heart is used to beating faster, when you are not doing athletics, it's slower than 80. So it could be lower, it could be faster, and yet fall within normal. For children, their heart is beating faster than 80. But for a normal adult, it's 80. So you can calculate it. In a minute, it beats 80. In 1 hour, how many times does it beat? In 1 day, how many times does it beat? More than 100,000, more than 110,000. In 1 year, how many times does your heart beat? In a lifetime, how many times does your heart beat? And it's not all under your control. If your heart skips a beat, you know. It beats regularly. We don't control it. God gave it to us, a free gift. We don't even think about it. We don't even appreciate it every day. If one of those beats stops and it doesn't continue, it's finished. And that's how we generate our pressure. Okay, let's go to the next slide. All that I've said is normal. It's normal. Now I'm going to look at what is abnormal and why we say is normal, is abnormal. Often in the clinic, people say, which one should I focus on? The top one or the bottom? Which is the one that is abnormal? I will say both of them, if it becomes abnormal, is bad. Either the top or the bottom can be abnormal. So what is normal? The next slide. What is normal? Next. Normal, like we say, is 120/80. But that depends on the time. Yeah, 120/80. Now, abnormal depends on the condition. If somebody has 130/80, under some condition, we can say this person is hypertensive. If somebody has 120/85, under some condition, we can say this person is hypertensive. But irrespective of the condition, if you have 140/90, we will ask you to come back and do it again, because we suspect that you have hypertension. And we will say why people have hypertension. Next, please. Conditions like heart disease, kidney disease, goiter or thyroid disease, stroke, pregnancy. Under these conditions, blood pressure goes up very quickly. And if they reach 130, we begin to pay attention. So we don't wait for it to get to 140 under those conditions. So let's go to the next slide. What are the causes of high blood pressure? This is what is most important slide that I have. What are the causes of high blood pressure? Indeed, 90 to 95% of high blood pressure, we do not know the obvious cause of the high blood pressure. And again, there are two things here. It's 90 to 95%, which means only about 5 to 10% can we say there is a cause for their blood pressure. Majority, 10 people come with high blood pressure, only one I can say, oh yes, that's the cause. The other 9 I cannot say. And the other part of it is this: there is no obvious cause. Mind the word obvious. There is a cause, just that it's not obvious. I will come back to this because this is important. Now let's look at the ones that have causes. The cause that all of us cannot escape from is aging. We cannot escape from aging. Why is it? Because our capillaries, our veins, our vessels, our arteries, they become stiff as we grow older. They are no more as compliant, they are no more as flexible as they used to be. You can see it from our skin. What happens on our skin happens inside our body. The baby's skin is very flexible, very compliant. Our skin is like our blood vessel. It gets depositions. That happens. So that we will expect. So our BP will go up. Somebody that used to have 120/80 when they are 20-25, at 45-50, you don't expect to have that anymore. So that is constant. And that also goes with obesity. The medical terminology for it is atherosclerosis. I showed in the previous slide a yellow plaque depositing in the arteries. If you remember my slides last year, it's the same thing that happens here. That's why the blood pressure goes up. That we can't do very much about. The next one. Hormonal changes. This happens especially at specific times in women's life, even in men's life. When they go into menopause, when they are pregnant, and when they are taking some kind of contraceptive pills, it changes the hormonal balance, and that causes high blood pressure. For example, pregnancy, it's like an additional resource requiring an added demand in a woman's body. You have extra blood and you need to supply extra blood. You need to pump extra blood. So it's like somebody who is big or tall or huge that needs to pump extra blood. So you need to pump extra blood to the baby, and that places a lot of load. And that is why that could cause hypertension. Next, please. And then these organs, sickness of any of these organs, like I've put the picture, we call them endocrine organ, ranging from the brain. I'm not going to call specific things, but hypothalamus, pituitary, any of them, thyroid, thymus, pancreas, adrenal glands, and kidneys, and the gonads. All of them, they can cause us to have high blood pressure. These are specific sicknesses. But again, all these that I've said, what did I say before? They only belong to 5 to 10% of people who have hypertension. We will now go to the next slide. The 90% of those, okay, again, this is weight gain, obesity, like I said before. Obesity and increase in age. They all cause hypertension. Again, they belong to the 5 to 10% of the people who have hypertension. 90% of the people do not have. Next slide, please. That brings us to the 90% that the cause of their hypertension is not obvious. If you look at these 4 images, can you identify, can you relate in any way with the emotions they are expressing? Do we express these emotions sometimes?
All the time.
Do we express any of these emotions sometimes? These emotions and many more. Many more. Anger. But it's not just the burst of anger. It's the anger that we hold on to and never let go. That is the destructive anger. That is the silent anger. It is the anger that we pretend we don't even have. It is the anger that we say, we keep inside our heart, year, months after months, week after week, year after year, that causes the damage. Very silent damage. And damage that we will only realize when it is already too late. That is the anger that deals the damage. The same thing goes with hatred, malice, jealousy. And the same mechanism goes for worries, anxiety, envy, and a host of negative stress-inducing emotions. Indeed, every one of us have reasons to express these emotions. Every day, there are things that cause us to be angry. Isn't it? There are things that cause us to hate. Isn't it? However, eventually it comes down to the individual. Because it all boils down to how you handle the things that come, the challenges that come to you. What makes you angry might not make the other person angry at all. It might make them just say, okay, that's his life, that's the way he wants to do it, and they go. I could do something to him or something to him. He goes out, he comes back, he's smiling again. While the same thing, or even something much less, I do to somebody else.
Fire for fire.
And they go out and they come back, and 2 weeks later I greet them, they don't want to answer. 1 month later I'm greeting them, they don't want to answer. This, I like to listen to Spirit Radio, and this morning I turned on the Spirit Radio and they're talking about 70 times 7. And I said, oh, this is what I was thinking of preaching. And what they said was, Jesus was speaking to Jews, and the word 7, it means a lot to them. That's why he said 7 times 70, and nobody asked him any further question. They knew it completely. They knew it entirely. As soon as he said 7 times 70, they knew he's saying, look, Forgive all and all the time. And they say something that I also have been thinking about. How many people can actually offend you that much in one day? Only the people that are closest to you can do that. And even them cannot do that much. So we are holding on to anger, we are holding on to hatred and destroying ourselves. This is how God connects with the Bible, with science. When he says, love your enemies, isn't that the biggest medicine that he has given to us against hypertension? Even that, the biggest that he has done for us, we are not even having enemies. I mean, the people that are making us to be sad or to be angry are not our enemies. Often they are our wives, our husbands, our children. The common man in the street cannot do that. Or maybe a church member can do that. A church member can do that to us. We hate so much, we don't want to talk to them anymore. Is that what God said? People try to reconcile us. We are supposed to be the ones reconciling others. People try to reconcile us, but our reconciliation is only on the surface. Enough for us to smile. Enough for us to be comfortable in our cliques. That is causing a lot of health problem to us without our knowledge. That is the unfortunate thing, because it's causing damage that we do not know. You see, when I was in Nigeria and I was in the clinic, in medical clinic, we used to give, at that time, the manual fig came out and people will buy it and take it home, and then we'll give them a chart and we'll say, document your BP on mornings of so date before you come. So when they come, and we bring and we see. When we see, okay, and we'll note and we'll give them advice on that. And we'll talk to the patient maybe 2 minutes, 3 minutes, 4 minutes, 5 minutes, and the patient will go. And the professor will turn around to the students, turn around to us, and will tell us. He said, on so date, this woman did not sleep at night. How did he know? Because in the morning, he saw the BP. See that man? The wife is sleeping. Some things keep us awake in the night. And we are thinking. And some of the things that keep us thinking are things that we can very easily let go and say, take control. Some of us go to bed. It's 2 a.m. We are still rolling around and not able to sleep. And some of us go to bed. We go at 10. We sleep very early. By 1 a.m. we have woken up. 4 a.m. we are still turning around and looking at our time. That is not what God desires for us. Apart from it, take it out of the context of the Bible into medical field. That is causing us a lot of damage. And I will show us what kind of damage that is causing us. There are various kinds of stress. Like I said, each one of us has reason to have stress. Every single one of us. I'm not going to say there isn't anybody who doesn't have stress. What can be stressful to me may not be stressful to you. Maybe you have already passed through that stage, and when you were at that stage, the way you handled it was so smooth and so good, and it wasn't stress for you. And when I hear your own, I will look, is it the one that is making him? This is not a problem at all. You understand? So everybody has reasons to have stress, but everybody also has reason to cast it to Christ. What Christ is asking us to do is the way we should normally approach life. The way our life should be, so that we will prosper in all things and yet be in good health. So again, think about this slide and any other images that you think might fit into the slide, and work towards how you will solve that problem in your life. it is not necessary for you to become dependent on drugs. Because when you have hypertension, even if you already have hypertension, you can manage it that you will not become dependent on drugs. You can still have good health. Just like I said in case of diabetes last time. Does not mean that if you already have hypertension, you cannot have good health. You understand? Some people already have hypertension, yes, and they are not on any big medication. Maybe one tablet a day, maybe one tablet in 2 days, because they have been able to do things and manage it on their own, and they do not put it all down to drug. If you are taking drug and you have not solved all the problems that we are saying since morning, look, your medicine will not stop on 4 or 5. It will keep going on. The doctor doesn't care. When you come, oh no, the figures are not the figures are 140, 90. Oh, what else did we give? What did we give you the last time? He asks you, he look at it, okay, we increase your dose. This is what the professor taught. Okay, you are on 3 different drugs now, we add 1 more. Instead of him telling you, is there something you can do so that we can work towards reducing it from 3 to 2? And when you come to 2, can we reduce it even to 1? Now you are taking in the morning and the evening. Can we try to reduce it so that you'll be taking only in the morning? Can we be skipping 1 day, 2 days, so that you will be taking only 2 or 3 times a week? Just because you adjust your own habits. Sometimes you don't have anybody to hate. Sometimes it's just because fear of the unknown. How will tomorrow be? How will tomorrow be is the one that is keeping us awake in the night. And there are reasons that we shouldn't be. I have prepared only about 10 slides. I don't know I think number 9 slides now. But prepared very few slides so that we'll have to talk and to chat and to ask questions. Because last time I discovered we did like to ask questions, and we will close very early today. So I'm about close to the end now. Next slide, please. How do you know that you have your blood pressure is rising? How do you know? Most of the next please. Most of the time we do not realize that our blood pressure is rising. It is very silent until it has already caused damage, until it begins to damage our organs. When we have signs of the underlying cause, we will know. If you have goiter, it's easy for you to know. If you have menstrual problems, or if you have, you can easily tell that you are having high blood pressure. When you have this kind of signs, like hormonal imbalance, you get tired easily, easy fatigability. Your mood begins to swing. Things that are easily said to you begin to make you highly irritable. Something that shouldn't make you angry makes you angry. You will know that things are not well with you. Some people begin to gain weight. Some people, the way they think is not very clear anymore. Their mind is not very sharp or clear anymore. Then that you realize that your health is not as it should be. Again, I've talked about insomnia, sleeplessness at night. I've talked about sweating at night as well, depression, joint pains. Some people develop pimples like we call acne. Some people have very low libido at that time. These are signs that all is not well with you. I had a friend who didn't know he had high blood pressure until one day he started to vomit. He had headache, he started to vomit. This didn't start that day he was vomiting. Probably started 5, 6, 7, 8 years before then. And he did not know. Didn't have any cause to see a GP. Very healthy person. We thought. He looked very strong and very well built. Looked very healthy. But he's a very worried person. A very sleepless person. Giving health up on worry is a very difficult thing. Because you tell people, don't worry. How do you say that? You see that song that say, don't worry. I thought it's a very stupid song. I thought it's a very stupid song. How can you tell somebody, don't worry, be happy? Is it like that? Are you stupid? Only foolish people. Don't worry. Bible didn't say, don't worry. It said, cast your cares. So you have cares. Learning how to cast them. We do have cares. And we should have cares. But we should not carry them on our own. That's what Bible said. Next slide, please. Controlling BP, like controlling diabetes, like controlling the heart problems that I said. You already know what I'm going to say, and I'm not going to say much about this. I did say a lot about exercise, and many people approached me after the last talk about exercise, and I was very encouraged. Many of us are already doing exercise. Again, the only thing I want to say now is, exercise is like you should tailor it to your own need. What did the Bible tell us about spiritual health? If you do not plan to build your spiritual health, if you don't build your own life, your spiritual life, you die spiritually, isn't it? You put your Bible there, only when you come to church, you look for it and you come. You don't read it. You don't grow. You don't stagnate. You die spiritually, isn't it? It's the same about our health. If we don't make any plan for our health, we die gradually. It might take many years, but one day it will be manifested. One day the doctor will read it and he will come to and he will tell us. And after that, every time the doctor brings out his feet and wants to put it on your arms, your heart skips a beat. You don't know what the verdict is going to be. But if you are already planning and you are already targeting a blood pressure, you are expecting a good news. You are already expecting a good news. I can only encourage you to work towards hearing good news about your blood pressure. And I'm not saying one specific exercise, but every one of us, irrespective of the age, must have at least one kind of exercise that we are doing. Easy exercise, difficult exercise, depending on who you are and how it suits you. But none at all is wrong. See that old man, he's just holding hand and pulling like this. That's his exercise. At least every one of us can do that. If you are young, that's too small for you. You should look for something to do and do the right one. Not doing anything at all is bad. Now, food, the kind of food that is good for people who have high blood pressure is the kind of food that I said you should normally eat anyway. We should stay away from a lot of oil, a lot of fried oil, a lot of fried food. Cut it down. Cut it down. Don't do it to such an extent that they'll say, please don't eat it again at all. So if you cut it down now, you can eat it for the rest of your life. But if not, a time will come, they'll say, sir, I think it's better for you to stop it. The other thing is potassium and fibers. Potassium like this, I didn't put banana. There should be banana there, but banana has high potassium. Banana has high potassium. There's milk also, high calcium. So potassium should be high and sodium should be low. Next, please. So I've talked about exercise, drink plenty of water, of course, that goes. I've said that last time. I said fizzy drink, we shouldn't do that. And we should increase the level of our water drink. Now, alcohol, we should limit it. We should not overindulge. I believe that none of us is a smoker. I just put that as... Okay, next one, please. Salt. We should not eat raw salt. Table salt, no raw table salt. Every salt we eat should be cooked. Every salt we eat should be cooked. Instead of too much, too little. This is one case that little is much. So put that. Raw salt is not good in anything. Next, please. Stress. I've talked a lot about that. Do everything to exercise your faith with stress. Yes, please. Next. And this is the last one. I would say, in this condition, I would say, maintain a healthy body weight. What do I mean? Some people are naturally big. I'm not going to expect them to become like me overnight. So work towards the weight that is good. You already know when you are gaining weight and it's getting out of your control. You will know it very quickly from your knees. When your knees cannot carry your weight anymore, it's time for you, shouldn't even get to that level. Beginning to have a lot of knee pain, a lot of joint pain, it shouldn't get to that level. Maintain a healthy weight. Many of us need to think about that very seriously. And if you want to talk to me on a personal note about that, it's good. I know that, like I said, some people genetically, just because of their family, their mother, their father are big. So they are going to be big anyway, but they should do it within a healthy boundary. Have a balance. Finally, I will say to you, take care of your health. Don't overdo anything so to the extent that we will say, stop doing it. Next one, please. This is a very short clip of what will happen if you let your hypertension go out of control, go unattended to. And it's very easy to go unattended to because it's something that doesn't have any symptom or sign. It doesn't push you to the doctor. The hypertension will let you be until you die. It will be comfortable, enjoying your body, and let you continue whatever you are doing. No headache, nothing. There could be somebody in this room that will have a blood pressure of 230/100, and he or she might not know, will not even know. There are people who have come to the clinic like that, not suspecting anything, and you discover they have that kind of blood pressure. So it can come to a stage like this. But it's still within our power to make sure it does not get to that stage. If we know what we should do and we are doing it, we are disciplined to do it. It takes discipline. It's not just going to happen. This is going to challenge you more than any achievement that you have ever done. This is going to challenge your determination beyond anything that you have ever done. Don't take it lightly. It is going to be more challenging. So like I have listed, chronic high BP, vascular damage, heart attack, heart failure, kidney failure, blindness. Imagine that you are blind for a minute, or for an hour, or for a day. That beautiful person you can't see anymore. It's even more difficult for somebody who used to have eyesight and who doesn't have eyesight anymore. Imagine how it will be for you to be looking for your toothpaste or toothbrush. All this can happen from high blood pressure. But the one that the doctor also doesn't even like is stroke. Can you play that clip, please? This is a 2-minute clip, a very short clip, for us to see what stroke looks like. This shall not be our portion in Jesus' name. Amen. This is how stroke looks like. You lose one part of your body. You can't use one of your leg. You can't use one of your hand. Your eyes, one of it is not working. You can't smile. Nigerians love to laugh, isn't it? We enjoy laughing. You look even that thing. Is it me? Is it me that is causing that?
He said it's pressure.
Blood pressure, isn't it? So this is what many people have to endure at the end of their life. Irrespective of what you achieve, will you exchange those achievements for this? In Nigeria, I sit in clinic, and often when stroke patient comes in and I ask them, what exactly is troubling you? Often they tell me, oh, it's my daughter, 16-year-old, 17-year-old, doesn't listen to me. Or it's my mother, or it's somebody else. I can't sleep at night. It's a very, very common saying. But again, like I said, we all have reason to have stress. It is how we deal with it. It is not the fault of the other person. It is not the fault of that girl. It's not the fault of that boy. It is the way you handle it. So let's go to the last slide now. I think the very last slide. So this is what we run away from. This is why we give health talk. The very last slide. So like we started, we built a foundation. We will conclude in it. It's a season of love. We experienced it yesterday, and we read about it today. Of all the things that I've talked about stress, the most important thing to solve this is love. First of all, think about it. It is love for your own body that we are talking about. It is love for your own body. When we say forgive that person that is offending you, it is love for your body. If you attain that level of reconciliation with that person that had offended you last year or yesterday, it is love for your body. It is love that we are talking about. I will say, all of us, we should learn to love our body. We should learn to care for our health. Because if we do not do, the consequence will come. And when it comes, it will be very, very serious. That will be the end of my talk today. Thank you very much.